Hi, my name is Stacy Soappman, one of the Aspire faculty members, and today I'm going to demonstrate a cuboid manipulation. So I've gone through and done a detailed subjective and objective examination of the patient's foot and ankle, and what we determined was that the cuboid was fixated in a plantar direction. It could not move dorsally on the calcaneus, which clinically is something I see quite often. I see it a lot following sprained ankles, in my runners, my basketball players, things like that. So I've gone through, done my examination process, and now I'm going to demonstrate the technique that we would use, or one of the techniques we could use to correct this fixation in the foot. So I have them bring their foot up here for me, please. I've already gone through and I've looked at his chart and I've gone through things with him. He is appropriate for manipulation. There's no red flags. There is no contraindications to manipulation. So we know we're safe to proceed with this technique. To actually do the technique, I grab the foot, bracket my fingers here on either side of the cuboid so it has a direction to go. My thumb is going to be on the plantar surface of the cuboid. And remember, when we're palpating the bottom of the foot, the cuboid is this, it takes up a large amount of space on the bottom of the foot, so I don't want to be way out here. I need to be on the center of that cuboid, okay? So bracketing, so it has a place to go. Thumb on the cuboid, I'm going to reinforce with my other thumb. I also want to keep him in this nice neutral dorsiflexed position, okay? So we don't want to do it in a plantar flex position because we want to protect the tailocrural joint. By keeping it dorsiflexed, we do. So my pre-manipulative hold is I'm going to overpress that cuboid into the dorsal direction. Hold it for 10 seconds. Does that reproduce your pain? He says no. So I have his verbal permission, no contraindications, and the pre-manip hold was negative. So we can proceed with the technique. We come in here, and basically what we're doing here is it's a really quick flick with my thumbs overpressing that cuboid into the dorsal direction that it could not go before. So following the technique, I do need to reassess to make sure that it was successful. And if the technique was successful and we now have that cuboid calcaneal movement that was missing before, we would move on to an appropriate exercise plan following that to help maintain the new motion we just regained. So thank you for joining us. If you have any questions, we'll take it in the comments section or you can check us out on our website.